America loves to talk about individual responsibility, pulling yourself up by your bootstraps. But here's the thing, sometimes those bootstraps are frayed or missing entirely. That's where the social safety net comes in. It's there to catch people before they fall into poverty. It's about basic dignity and support for those who need it most. Think of it like insurance for life's curveballs, job loss, disability, a medical crisis. These things can happen to anyone. Social Security, SSI, SSDI, VA benefits, these programs are designed to provide a safety net for millions of Americans. They're not handouts, they're lifelines. And let's be clear, these programs are not just about helping individuals. They're about strengthening our entire society. When people have basic security, they can contribute more fully. They can work, they can spend, they can raise families without constant fear. A strong safety net benefits everyone, not just those who directly rely on it. Imagine living on a fixed income. Every month you receive the same amount of money. No raises, no bonuses, no matter how hard inflation bites. That's the reality for millions of Americans relying on Social Security, SSI, SSDI, or VA benefits. Now imagine the price of groceries skyrocketing, your rent going up, prescription drug costs through the roof. Suddenly, that fixed income doesn't stretch nearly as far. This isn't about living extravagantly, it's about affording basic necessities, food, shelter, healthcare. The struggle is real, and it's getting harder. For those on fixed incomes, every unexpected expense can trigger a financial crisis. A car repair, a broken appliance, a medical emergency, these can be devastating without a financial cushion. It's a constant balancing act, and even a small dip can throw everything off. Recently, there have been announcements about extra payments for some beneficiaries. We're talking about potentially $2,200 or $1,900 more in a single month. Now, I know what you're thinking. John, that's a takeout order for you. But for someone struggling to make ends meet, that's life-changing. That extra money could mean catching up on bills. It could mean buying groceries without agonizing over every penny. It could mean finally seeing a doctor about that nagging health issue. It could mean a little breathing room, a chance to exhale after months of holding their breath. These one-time payments are a band-aid, not a cure. They highlight the inadequacy of current benefit levels in the face of rising costs. But for those receiving them, they offer a moment of relief, a chance to address urgent needs, and a glimmer of hope. Social Security. It's not just a program, it's a promise. A promise made to generations of Americans that after a lifetime of work, they'd have some financial security in their golden years. It's the bedrock of retirement for millions, but even this bedrock is feeling the strain. Here's the gist. You pay into Social Security throughout your working life. Those contributions then fund benefits for current retirees. It's a pay-as-you-go system, and for decades, it worked pretty well. But with longer lifespans and a shrinking workforce, the system is facing challenges. That doesn't mean Social Security is going bankrupt, despite what some politicians might claim. But it does mean we need to have a serious conversation about its future. How do we ensure its solvency for generations to come? How do we adjust to demographic changes? These are questions we can't afford to ignore. Section 5. SSI and SSDI, a lifeline for the disabled. Social Security Disability Insurance, or SSDI, and Supplemental Security Income, or SSI, are lifelines for Americans with disabilities who are unable to work. SSDI is earned, like retirement benefits, based on your work history and contributions. SSI, on the other hand, is for those with limited income and resources. Qualifying for these programs is no walk in the park. It involves navigating a complex bureaucracy, providing extensive medical documentation, and often enduring lengthy appeals processes. It's a system designed to weed people out, not welcome them in. For those who do qualify, the financial support provided by SSDI and SSI is often the difference between having a roof over their heads and homelessness. It helps cover basic needs like food, housing, and medical care, allowing individuals to focus on managing their health and maintaining a basic quality of life. Section 6. Honoring Veterans, VA Benefits Explained. Serving in the military is a sacrifice. You put your life on the line for your country, and when you come home, you deserve support. That's where VA benefits come in. They're not a handout, they're a recognition of service and sacrifice. These benefits cover a wide range of needs, from healthcare to education to housing assistance. They're designed to help veterans transition back to civilian life, address service-connected injuries, and provide financial security. But accessing these benefits can be a bureaucratic nightmare. The VA is a massive organization, and navigating its complexities can be overwhelming. Veterans often face long wait times, confusing paperwork, and a lack of clear information. It's a system that often seems designed to discourage rather than support those who've served. Section 7. The squeeze costs keep climbing. Here's a fun fact that's not fun at all. The cost of living keeps going up. Inflation, that sneaky devil, eats away at the purchasing power of every dollar. And for those on fixed incomes, it's like watching their money disappear in real time. Housing costs are soaring, especially in urban areas. Healthcare expenses are enough to induce a panic attack. Food prices? Don't even get me started on the price of eggs these days. It's a perfect storm of financial pressure. This relentless rise in costs puts immense strain on individuals and families living on fixed incomes. It forces them to make impossible choices between paying rent and buying groceries, between filling prescriptions and keeping the lights on. It's a constant state of financial triage, and it's simply not sustainable. Section 8. Political football benefits under scrutiny. Social Security, SSI, SSDI, VA benefits. These programs are often caught in the crosshairs of political debates. Some argue that they're too generous, that they discourage work, that they're unsustainable in the long run. Others point to the millions who rely on these programs for survival, arguing that cuts would be cruel and devastating. It's easy to get lost in the political back and forth, the partisan bickering, the endless debates about budgets and deficits. But we need to remember, behind the numbers, behind the policy arguments, are real people's lives. These programs are not abstract concepts, they're a lifeline for millions of Americans. They represent a promise made to seniors, to veterans, to those with disabilities. And when we allow those programs to be used as political bargaining chips, we're failing to uphold that promise. Section 9. Enough to live on? The debate rages. Here's a question that should be simple, but rarely is. Are the benefits provided by Social Security, SSI, SSDI, and VA programs enough to live on? The answer, as with most things in life, is complicated. For some, these benefits provide a basic level of security, allowing them to cover their essential needs. For others, it's a constant struggle to make ends meet, to stretch every dollar to cover rent, food, and healthcare. The adequacy of these benefits varies depending on individual circumstances, geographic location, and the ever-fluctuating cost of living. The debate over benefit adequacy is often framed as a battle between generosity and fiscal responsibility. But it's more nuanced than that. It's about ensuring that everyone has the opportunity to live with dignity, regardless of their age, ability, or service to their country. Section 10. Real stories, real impact. Why it matters. Behind the statistics, behind the policy debates, are real people's lives. The senior citizen who relies on Social Security to afford their medications. The veteran struggling with PTSD who depends on VA benefits for mental health care. The single mother with a disability who relies on SSI to feed her children. These are not just numbers on a spreadsheet. They're our neighbors, our friends, our family members. Their stories matter, their struggles matter, and their well-being is a reflection of our values as a society. A strong social safety net is not about handouts, it's about opportunity. It's about ensuring that everyone has a fighting chance to live with dignity and security. It's about recognizing that we're all in this together, and that when one of us struggles, we all have a responsibility to step up and offer support.